Hi, Dr. Berry. My name is Sarah, and I'm a medical student. I was assigned to shadow you today.
Oh, great, nice to meet you. Our first place is just inside here in the exam room.
Oh, so what's her name?
Oh, it's on the chart here somewhere. Oh, Mrs. O'Brien, I hear you burned your hand while you were studying.
Yeah, I did. I know it sounds ridiculous. I can't be allowed to warm soup within 5 days of writing the HVAC.
Says here you burned your hand when you grabbed onto the pot. You must have held onto it for quite a while. These burns are extremely deep.
Oh, yeah, I guess I held on to it and I didn't really feel it for a second and then I dropped it.
There are some deep partial thickness burns here. Get her a gram of Kefazole and a tetanus.
It's too bad, really. You know, that I burned my hand like this. I'm supposed to be writing my HVAC in 5 days or so, and, you know, this is the 5th time I'm taking it. Can you believe it?
It's quite a bad burn, but I think you'll be fine for the test on Saturday, not to worry.
I will?
Dr. Berry, I think she's lying. Something's off about Miss O'Brien's story. Did you see her reaction when you told her she'd be okay to take the test again? That was not relief, that was panic.
I think she'll be fine. She came into the burn and got treated for the burn. End of story.
Miss O'Brien, you're back. Is everything alright? I thought you were writing a test today.
Oh, well, you know, just me and my clumsy self. I burned my hand again this morning when I was making breakfast.
Oh no, are you sure it was an accident? Dr. Berry, Miss O'Brien is back in A&E with the same burns on the same hand.
Okay then, same as last time. You know the drill, treat the burn.
Don't you think there's something more to this case?
Don't you know how many patients are waiting in A&E? Did she say explicitly that something was wrong?
Well, no, but
Well, then treat the patient.
Hi, Dr. Berry. My name is Sarah, and I'm a medical student. I was assigned to shadow you for a day.
Oh, great. Our first patient is Miss O'Brien. She's just in this room. Hello, Miss O'Brien. My name is Dr. Berry. This is Sarah, who's a medical student assisting me today. Is it okay if she's here?
Yeah,
Great. So, I hear that you burned your hand while you're studying.
I know, it sounds ridiculous. Can't be allowed to warm up soup within 5 days of taking the HVAC.
So, it says here that you burned your hand when you held the pot. You must have held on to it for a while, though, because these burns are quite deep.
Oh, yeah, I guess that's right. I held on to it and then I dropped it.
These are partial thickness burns here. Can you give her a gram of Kefazole and a tetanus, please?
It's too bad, really, you know, that I did this to my hand. I'm supposed to be taking the HVAC again on Saturday. This is the 5th time I'm taking it. Can you believe it?
These burns are quite severe, but I think we'll have you patched up in time and you'll be able to take your test.
I will?
Do you not want to?
Of course I want to. Why wouldn't I? Yes, I'm nervous, but anyone in my situation would be.
Did you burn yourself on purpose? It's okay if you did, but I just want to understand what you're going through.
I can't sit this damn test again. What if I mess up again? Can you imagine taking the HVAC for the 6th time? It's all I'm known for. It's all anyone in my family talks about. It's as if it's branded on my forehead. E for the failure. It's just pathetic. I can't sit that test again just to prove to everybody how pathetic I am. Not when...
When you already feel like that about yourself.
Yes.
Well, I'm really glad you came to me about this.
I know it can be difficult. I took your HPET 3 times.
I think it would be helpful for you to talk to a colleague of mine.
Like a psychiatrist?
Well, yeah, I think it would be beneficial for you to talk to a professional about it.
No way! I'm not crazy. I want to go home. I don't need to see a psychiatrist. I am not crazy.
I know you're not crazy, but I'm afraid that if I let you go without seeing or talking to someone, that you'll end up hurting yourself again.
It's okay to seek help. We need help sometimes.
I'm not crazy. I just don't want to go through it again.
And that's completely understandable. But what we'll do is that I'll give you the information of my colleague. Here's her number and her office. And I'm gonna see you in 3 days to check on your burn, and we'll talk about it again. So take some time to think about it, okay?
Okay.
Great. So, what do you think about what just happened?
Well, I think it was really great that you gave the patient time and attention to open up to you. Other physicians would have just looked past it and just treated the wound.
And why do you think that's important?
It is important because I think medicine is not just about treating the condition. It is about considering the patient's experience with the illnesses and listening to their story.
Do you think there's anything to gain from listening to a patient?
Yes, definitely. By listening to the patient, we build a rapport and a trusting relationship. This allows them to review information about themselves or their condition, which we might not know otherwise.
And do you think this benefits the physician at all, or is it just a waste of time?
It benefits the doctor because there will be less risk of miscommunication and therefore less improper diagnosis, and also by listening to the patient, it helps us to empathize with them. And with practice, the physician will then be able to demonstrate narrative competence efficiently, so it might not necessarily use up too much time.
You're going to be a great doctor.